Hello, everybody. Hello and welcome. Can everyone hear me? How am I sounding? Let me know in the chat and we will go ahead and get started. I hope everyone's having a wonderful Monday so far. Thank you so much, Miss Dolly. Thank you so much. All right, so as I said, hello and welcome to another week of ICD-10 Guideline Mastery Sessions. I'm Miss Haley. I'm going to be your lead instructor for this class, and I am so excited to welcome new and returning coders to our Monday night class. So we are in week 2 this week. So today we are going to be going over and reviewing some infectious disease guidelines. So this is going to include your HIV and AIDS, your sepsis, severe sepsis and septic shock, MRSA, Zika virus, and your COVID-19 infections. So I'm going to be using our ICD-10 guidelines and referencing our MCG manual. So I'm going to be using both of those books. So make sure to have those both handy if you can. We will also be doing what we did last class. We are going to be doing our live Jeopardy game, and we're going to be testing some guideline mastery skills. And then we are going to move on to our in-depth scenarios. And as always, I will click through the guidelines I'm going to reference in the Jeopardy game. So we can also use this video as a study tool in the future. All righty. So without further ado, all right, we are going to go over our copyright real quick. All right, so ICD-10 Copyright 2026, American Medical Association, all rights reserved. Fee schedules, relative value units, conversion factors, and or related components are not assigned by the AMA, are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained. ICD-10 is a registered trademark of AAPC. AAPC content found within this presentation is copyright of AAPC. Keyword concept FTR, CHUN, AMCI Fab 7, ICD-10 Flip, TAP, and MCG are trademarks of AMCI. The credentials CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by the AAPC. AMCI does not own the rights to these credentials. The credentials CCA, CCS, CCS-P, RHIA, RHIT are owned by AHIMA. AMCI does not own the right to these credentials. Whew, all right, that was a mouthful. Okay, so we are going to go ahead and just hop right into it with our warm-up. So I'm going to go ahead and stop sharing my screen really quick. I'm going to go ahead and grab our first game. We're going to be doing what we did last week with our Jeopardy game. And while I'm grabbing that, I just want everyone to know, and I want to thank everyone that put in their surveys last class. We're going to be posting that link in the chat. If you have to leave early, please make sure to take some time. Thank you so much for posting in the chat. Make sure to click that. If you have any questions about the class, or if you want to give us some feedback so we can improve classes in the future, please click on that and we will get back if you ask a question, and we will be thanking you for your survey. It is always appreciated. All right. So these are going to be our categories for this week 2. So the categories are going to be split into HIV and AIDS, sepsis, severe sepsis, and septic shock, MRSA and Zika virus, and our coronavirus infection. So if you weren't here last week, these are all going to be true or false questions, just to kind of get us to warm up and kind of get a little bit of review. And these are all going to be taken directly out of our MCG manual, out of our ICD-10 guidelines. And after this, I will quickly go over all of the guidelines I specifically used. But I did add a lot, so we will definitely have a lot of questions for tonight. So let's start off with an HIV and AIDS. Let's start off with an easy one, just to get us warmed up for 100. All right, a true or false. Well, these are all true or false, but yeah. All right. So once assigned the code B20, and the B20 is the code for HIV disease, the coder may never use any other HIV-related code for this patient. Is this going to be true or false? I'll give you guys a few seconds for this one, and good luck. All right, we're going to go a little quicker. This one was a pretty easy one, but we're going to go a little quicker since we just have so many questions so we can get through them all. Yes, this does mean not coding any other diseases for HIV. So yes, so this is going to be true. So I'm sure you guys have heard once an individual is B20, so once they are categorized as with the HIV disease, that B20 code, once they are diagnosed that, they will always be diagnosed that. So once B20, always B20. You're never going to code like a Z21 asymptomatic or anything else for this person. So once B20, always B20. It's definitely an important one to know. So great job, great participation to start off. All right, let's move to a 200 for MRSA and Zika virus. All right. True or false? For Zika virus, code only for confirmed cases documented by the provider. True or false? Do not be sorry for asking questions. Do not be sorry. I love questions in the chat. Ask them all. All right, so I'll give you guys a few seconds for this one. All right, indeed, you guys killed that one. Yes, you are definitely coding only confirmed cases. This is pretty much the case in a lot of viruses. You code only for confirmed cases documented by their provider. Great job. All right, let's move on. Sepsis, severe sepsis, and septic shock for 400. All right. Whoop. True or false? Still assign severe sepsis if the organ dysfunction is unrelated to the sepsis. What do we think for this one? If organ dysfunction is unrelated to the sepsis, are we still going to assign severe sepsis? True or false? All righty, so this one is going to be false. This one is going to be false. If you look again in the MCG manual, it says specifically, do not assign severe sepsis if the organ dysfunction is unrelated to the sepsis. So it specifically says to not do it. And so that would make this statement false. And I will go over, again, the specific guideline that I used for this one later on when this game is over. All right, let's do a MRSA and Zika. Actually, no, let's do a coronavirus for 100. We haven't done one of those. All righty. So, true or false? For confirmed COVID-19 with pneumonia, assign U07.1, the code for COVID, first, followed by J12.82, the code for pneumonia, to specifically identify pneumonia as being caused by COVID-19. I know this is a long one, but I'll give you guys a few seconds to break this one down. Good luck. All right. Amazing job, everyone. I think everyone got that one right. Great job. So yes, this one is going to be true. So if someone has COVID-19 with pneumonia, you're going to do COVID first, followed by pneumonia. All right. Great job. Let's move on. Let's go back to HIV and AIDS. Let's do that for 300. All right. True or false? If a patient has a positive HIV test result, but no symptoms or conditions, B20 should still be coded. The code for HIV, B20 should still be coded. Is this going to be true or is this going to be false? What do you think, coders? All right, so this one was kind of a tricky one. This one is going to be false. So in the guideline, instead of using B20, instead of using the B20 code, we're going to be using the Z21 code. So those are going to be the two most important codes when it comes to coding HIV. So B20 is HIV positive, and then Z21 is when a patient has a positive HIV test result, but no symptoms or conditions. So the patient has to be asymptomatic for this code to apply. So that's why it says if a patient has a positive HIV test, but no symptoms or conditions, Z21 should be coded, not B20. But that was some great participation. I'm so glad that everyone is still putting those answers in the chat. I hope we are learning stuff and you guys are doing amazing. All right, let's move on to sepsis, severe sepsis, septic shock for 100. All right, true or false? When coding sepsis, always sequence the systematic infection or the causal organism as the principal diagnosis. This one's a lot of words. All right, so how are we, when we're coding sepsis, how are we sequencing it? Are we always sequencing the systematic infection or causal organism as principal diagnosis? True or false? All right, so this one is actually going to be true. That one's going to be true. I know we had a little divide there, but again, I will go over the specific guideline where it says this specific snippet right here. So we will go over that so we can look back on it. You guys are doing great though. All right. Let's redeem ourselves. Let's do another sepsis one. Let's go for 200. All right. True or false? Coding for post-procedural infections does not require provider documentation explicitly linking the infection to the procedure. True or false? I'll give you guys a few seconds to look this one over. All right. Y'all nailed this one. This is indeed false. Yes, this is going to be false. So like we were mentioning before, you really need to have some provider documentation pretty much always. So for this guideline, it says coding for post-procedural infections require provider documentation explicitly linking the infection to the procedure. So assignments of the codes cannot be based on assumption. Definitely don't want to do that. So that is what makes this false. And I think everyone got that one right. So that is great. Great job. All right, let's move on to MRSA and Zika virus for 100. All right, true or false? MRSA or MSSA colonization means bacteria are present without causing illness. So this would be indicated by a positive screen or a positive nasal swab. Those would be some examples of this. Is this going to be true or false? I see the answers are already coming in, but I'll give you guys a few more seconds. All right. Indeed, this is going to be true. All right. So yes, MRSA, MSSA colonization, that's meaning bacteria are present, but that doesn't, it's without causing illness. Great job. I think everyone got that one right as well. And yes, someone brought up a good point about the last question. You can't diagnose post-procedural infection if you don't show as the procedure. I totally agree. Yeah, that's why we need some documentation. We love documentation. All right, next we will move back to coronavirus. Let's do a 400. Let's get crazy. All right. So when a patient has resolved COVID-19 infection with no active symptoms or infection, you're still going to code the U07.1. It should still be assigned. So if a patient has resolved COVID-19 and they have no symptoms, no infection, are we still going to be using that COVID code? True or false? All right. Amazing answers, amazing participation as always. So this one is going to be false. So the reason that it's false, again, looking at the guideline, it says for follow-up visits after COVID, fully resolved with negative test results, you can either code the Z09, so that's going to be encounter for a follow-up examination after completed treatment, or you can use a personal history code of COVID-19, but you're not going to still use the U07 because they no longer have COVID. So it's not going to be the same thing as like the HIV we went over, where it's once B20, always B20. Once you have COVID, you don't always have COVID. That's not going to be the case. So you would not use this code. You would use a history code or a counseling code. Amazing job if you got that right. All right, let's move on. Let's do an HIV and AIDS for 200. All right, true or false? When a patient encounter is for HIV testing and the patient has signs and symptoms, but the results are negative, code the presenting signs and symptoms. Ooh, this is a tricky one. Is this going to be true or false? What do we think? All right, I see some answers coming in the chat. All right, so this one is going to be true indeed. I thought it was a tricky one, but I guess not because everyone got that one right. So yes, so if you're going in for HIV testing, signs and symptoms, the results are negative, we're coding those signs and symptoms. If they came in with the signs and symptoms and they were HIV positive, then we wouldn't code them because they would be integral to that HIV diagnosis. But that is not the case. And so that is what makes this one true. Great job to everyone that got that one right, and everyone did get it right. So shout out to you guys. All right, let's move back to MRSA and Zika virus. Let's do a 400. Ooh, this is a long one. All right. For MRSA infections without combination codes, so examples of this would be a wound infection, a stitch abscess, or a UTI, assign the specific infection code plus B95.62, so MRSA as cause. Do not add Z16.11 penicillin resistance code. So I know that's a lot of words that I just threw at you guys, but I'm already seeing some answers in the chat. I'll still give you guys a few seconds. Good luck. Alrighty, so this one is indeed going to be true. And again, I'm just taking these snippets basically directly from our MCG manual. So yes, in this case, this is how you would code this this problem. So MRSA infection without combination code, this is how you would code it. And amazing job. You guys are, I feel like I keep saying amazing, but it really is amazing. You guys are doing awesome on this review game. Okay, let's go back to our coronavirus infection. Let's do a 300. Okay, so true or false? Assign U07.1, again, that's the code for COVID. So assign U07.1 for confirmed COVID-19 cases, regardless of whether the patient exhibits symptoms. What do we think for this one? Are we thinking true or false for this? Give you guys a few seconds for this one. All right, I think everyone got some good answers in. So yes, this indeed would be true. I don't think there's not a code for asymptomatic COVID. If you're testing positive for COVID, but you don't have the symptoms, we're still using that COVID code because you are still testing positive for COVID. So amazing job, and that would make it true. Great job, everyone that got that one right. All right, let's do another 300. Let's do sepsis, severe sepsis, septic shock for 300. All right, true or false? For severe sepsis coding and sequencing. So when present on admission and qualifying as principal diagnosis, code the systemic infection first. So when present on admission and qualifying as principal diagnosis, code the systemic infection first for severe sepsis coding and sequencing. I'll give you guys a few seconds to look this one over. I know that was a lot of words. Are we thinking true or false? All right, I'm getting a lot of answers coming in through the chat, so we'll go ahead. This one is indeed going to be true. And I think, again, everyone got that one right in the chat, so amazing job. So yes, so for severe sepsis coding and sequencing, if this severe sepsis is present on admission and qualifying as principal diagnosis, code the systemic infection first. That is true indeed. Great job, everyone. We got a few left. Let's go back to the HIV and AIDS for 400. All right. So, true or false? Use R75 when the provider cannot determine whether the patient does or does not have HIV or AIDS, and there is no documented signs, symptoms, or definitive diagnosis. What do we think, guys, for R75? When are we using this? Is this going to be true or false? Give you guys a few seconds to look this one over, and good luck. All right, let's go over this one. So this one is indeed going to be true. So yes, if a patient arrives at the doctor's office to receive HIV results and the results are inconclusive and the patient has like no signs or symptoms, then you would indeed use R75 as the code. So that makes this true. So great job. And again, we'll go over these codes right after this. So no worries at all if you need to look and see the exact code with your eyes. All right. We have just two more. I feel like we are absolutely flying through these questions. I thought I put too much on here today, but I did not. All right. Let's go back to MRSA and Zika virus for 300. Oh my goodness, this is a lot. All right. True or false? For a patient with both MRSA colonization and infection during the admission, how are we going to sequence this? Are we going to assign both Z22.322, so MRSA carrier or suspected carrier, and the appropriate MRSA infection code? Are we going to be doing that? Is that going to be true or is that going to be false? I don't want you guys to have to go and look up the exact code, so that's just why I put that in there, because that would be a lot to do in like 20 seconds. But I'll give you guys a few seconds to just figure out this true or false. All right, it seems that everyone has put true so far. Let's see. And you guys would be right. This is going to be true. This is how you're going to sequence for when a patient has both MRSA colonization and infection during the admission. That is how that is going to be sequenced. So shout out you guys. Yes, I agree, Miss Olga. You guys absolutely rocked that one. All right, let's end on a positive note because you guys have been doing great this whole time. All right, let's see what this one's going to be. Oh, this is going to be a long one. All right, so true or false? For patients presenting with signs or symptoms commonly associated with COVID-19, examples of this are going to be shortness of breath or fever, but without confirmed exposure and where the test results is negative or inconclusive, are we still assigning code for, are we coding for COVID-19 exposure? So if someone's coming in with signs or symptoms associated with COVID, but they don't have confirmed exposure to COVID and the results are negative or inconclusive, are we assigning the code for COVID-19 exposure? Is this going to be true or false? I know this is a long one, so I'll give you guys a few seconds to look this one over, and good luck. All right, so this one was a little bit of a tricky one. So this one is actually going to be false. So if a patient comes in and they have the signs and symptoms with COVID, but they don't have a confirmed exposure to COVID and their results for COVID are negative or they're inconclusive, then you are not going to assign the code for COVID-19 exposure or related conditions to support that COVID, because there's no way to prove. Just because they might have signs of COVID doesn't mean that they should have COVID-19 exposure, if that makes sense. Again, right after this, we will go over that exact code. So no worries at all. I know that one was a little bit of a tricky one, but that's okay. That's why we're here, to master these guidelines. And you guys are rocking these review questions. That is amazing. All right, I'm going to stop sharing my screen just for a second so we can get back to our PowerPoint. All right, give me 1 second, and I will present. So this video is going to be recorded. So if you guys need to come back and look at these guideline references, then you can definitely go back and do that. So I won't go through each and every one specifically because that would take all night, but I will quickly click through these. And if you need to look back at this video, then you can pause and look through it as long as you want to. So for our first one, so for our HIV and AIDS category, these are going to be all of the questions. These are going to be all of the answers. And then these are going to be all of the specific guidelines. These are going to be organized through the MCG manual. These are going to be all of the codes. So you can look at them through the MCG or the ICD-10 book, either way, but these are going to be the codes specifically that I use to get these answers. So these are our true and these are our false. Again, the reason that that one was false was because a patient has a positive HIV test but no symptoms or conditions. You're going to be using code Z21. All right. The next one, sepsis, severe sepsis, and septic shock. The questions, the answers. Again, the reason that the first one was false was because you need provider documentation, linking these. That's what made that false. And then the other one, you do not code severe sepsis if organ function is unrelated. All right. Next one, MRSA and Zika virus. All of these were true, so there's no false. But if you still want to go through some review, you are more than welcome to do that. Here are all the guidelines that I used. And last but not least, for our coronavirus infection section, these are going to be questions, answers. The reason that the top one was false, we just went over with the codes and the COVID-19 exposure. We just went over that one. And the reason that the last one was false was because you're not going to code COVID. You're going to code a personal history, or you're going to code that follow-up examination. All right. So without further ado, I'm checking in. I know that was a lot of information. I know we went kind of fast. How are we feeling? Let me know in the chat while I'm grabbing our next activity. With all of that warm-up that we did, we are now going to move on to some in-depth scenarios. So kind of like what we did last time. So we're going to do our keywords, we're going to do our guideline, and then we're going to put it all together and come up with some specific codes for those scenarios. All right. So I'm going to stop sharing my screen again just for a second. And then I am going to grab this is going to be the Quizlet like we were doing last time. All right. I'm glad that the explanations are helping. Thank you so much. And again, if you have to leave early, no worries. Just if you have any questions or if you want to provide some feedback on this class, the link to the survey is going to be in the chat. So definitely make sure you check that out before you go. All right, so this is going to be our first scenario of the night, and we're going to start off with focusing on keywords. So Mr. Weber was admitted from the nursing home after presenting with shortness of breath and a high fever. Laboratory tests confirm he has pneumonia due to COVID-19. So what keywords are we going to be taking out of this encounter? What are we thinking? What's going to lead us to the guideline? What's going to lead us to those final codes? I will give you guys a few seconds to put those in the chat. Let me know what you think. All right. Oh my gosh. Again, I'm always impressed on how fast that you guys can type. It is just insane. Everyone is saying pneumonia due to COVID-19. Amazing. This is what I'm taking out of it. The shortness of breath. I'm looking at the high fever. And as you guys all put, confirmed pneumonia due to COVID-19. So if you put any of those keywords, amazing job. All right, let's move on to the next one. So now we are going to be looking at what guideline we're going to be looking at to solve this. So this is going to be obviously in the COVID or the coronavirus section of your MCG manual. That's where we're going to find this specific guideline. But what do you think is going to be, what you can either put the exact number or you can put the title to the guideline. But what specific guideline are we going to be using to solve this one? Give you guys just a few seconds. All right. So yes. So the guideline we're going to be using is the IC. This is a long one. The IC1G1CI, or acute respiratory manifestations of COVID, specifically pneumonia. All right. So if you got that one right, and I see that a few of you guys did, that is amazing. All right, and now we are going to move on, and I know that a lot of people know the drill because we're putting those codes already in there, but we're going to be using keywords, we're going to be using the guideline, and now we're going to put it all together into specific codes. So what is going to be, again, Mr. Weber admitted from the nursing home after presenting shortness of breath, high fever, and the lab tests are confirming he has pneumonia due to COVID-19. So what ICD-10-CM code or codes is going to best describe this encounter? I'll give you guys just a few seconds because y'all are absolutely killing it in the chat already, but I'll give some people some more time to work on it, and good luck. All right, and if you are still working on it, I'm not going to give away the answer just now or just yet. I'm going to switch over to our PowerPoint so we can see everything all nice and organized really quick. All righty. Okay, so this is our scenario. I know I went over it a million bajillion times, so I won't read it again. So the keywords we're focusing on: shortness of breath, high fever, and that confirmed pneumonia due to COVID. This is going to be the exact snippet from the MCG of the guideline we're going to be using. So that acute respiratory of COVID-19 and pneumonia. And this was a really good first one to kind of have everyone warmed up, because if you look right here to the right, pneumonia due to COVID-19, it tells you exactly how it needs to be sequenced. So right here, it says sequence COVID-19 first. And so if you look right here, the first code, it even gives it to you. The first code is going to be that U07.1. And then this is how it's going to look in your ICD-10-CM manual. And even under it, so if you go to this specific code, even under it, it gives you further instruction. It says use additional code to identify pneumonia or other manifestations. So it says it right there, and it says it in the guideline too. So that is what's going to lead you to your second code, which is going to be this J12.82. Again, this is how it's going to look in the ICD-10 manual. J12.82, pneumonia due to coronavirus disease 2019. And even on the bottom of this, if you didn't look at all those signs, right here, it gives you instruction, code first, COVID-19. All right. So that was amazing. You guys did outstanding with that one. I'm seeing so many people put in their final codes. That is super impressive. Amazing participation, everybody. All right. And we are going to go back. We have two more scenarios that we have to do, but you guys just started off this in-depth scenario situation in an amazing way. So I hope you're patting yourself on the back. Brilliant work indeed. All right, and we are going to start over from the top with our keywords. So our scenario is going to be, Matthew is here today to find out the results of his HIV test. So far, he has never had any symptoms. The result is negative. The doctor spent time counseling the patient on safe sex to prevent him from getting the disease. So what keywords are we taking out of this encounter? I'll give you guys a few seconds on this one, and good luck. All right. Yes, indeed. I know a lot of you guys are still typing because that takes a lot of time to type everything out. But so if you're still typing it, still post it in the chat. But yes, we're going to be focusing on the results of the HIV test. We're going to be focusing on no symptoms, negative result, and we're going to be focusing on the counseling as well. So great job. All right. And next, we are going to move on. Same scenario. We're going to use those keywords, and we are going to be focusing on now the guideline that best describes this encounter. So again, this is going to be in the HIV section of the infectious disease guidelines in your guidelines. So to narrow it down a little bit, again, you can put the specific number or you can put the title, but I'll give you guys just a few seconds for this one, and then we will go over it. All right, if you are still looking up that code, still go for it. This is going to be what we are using. So we're going to be using the ICI-A2H, which is going to be negative HIV test without patient signs and symptoms. All right, now we're moving on. I know a lot of people are already putting them in the chat. You guys know what we're doing next. We are doing what specific ICD-10 CM code or codes best describe this encounter. So yes, we're still using our results of the HIV test. Never had any symptoms. The results are negative. Doctor spent time counseling. So putting all of that together, oh my goodness, you guys are killing it. I'll give you guys just a few seconds and then I'll switch over to the PowerPoint. All right, if you're still solving, go ahead. I'm not going to give the answer away just yet. I'm just switching over simply to the PowerPoint. So don't even worry. I'm getting a lot of like two different answers, the same two answers. So let's go ahead and see what this final code or codes is going to be. All right. Okay, so again, I won't read it all, but this is going to be our scenario. Our keywords for this are going to be results of HIV test, no symptoms, negative result, and counseling. This is going to be the exact, this one's a really long guideline, so I didn't snip the whole thing, but this is going to be the specific guideline. So negative HIV test without patient signs and symptoms. So there are two options here. They're on the right, which how you should code it. So there's negative HIV test, no signs and symptoms, patient receives counseling. There's a code for that. And then there's also positive HIV test, no patient signs and symptoms. So if we're using our keywords here, we're going to be using the first one. So negative HIV test, no signs and symptoms, and the patient is receiving counseling. And so that directs you to this code, which is going to be Z71.7. And this is what it's going to look like if you are going in your ICD-10 manual. So it's kind of around the drug abuse counseling and surveillance. You go down past here, and the Z71.7, human immunodeficiency virus counseling. And so that is going to be the code for that one. So if you got that one right, amazing. If you didn't, I really hope that the explanation made sense. And again, we're going to be using the 2026 ICD-10 manual, and we're also using the 2026 MCG manual. We're using the most up-to-date manuals. So I know that share my screen, and then we are going to do our last scenario of the night. Let's end on a great note. You guys have been doing absolutely amazing so far. Okay, so our next and last scenario. So a severely ill patient is presenting with low blood pressure, pale and cool arms and legs, chills, difficulty breathing, and decreased urine output. He also presents with mental confusion and disorientation. The doctor determined that he has sepsis with septic shock. What keywords best describe this encounter? I know there's a lot of keywords, so I'll give you guys a few seconds with this one, and good luck. All right. Indeed. I'm telling you, I'm so impressed with you guys regardless, but your fast typing skills are just super impressive. So yes, so there was a lot of keywords that we could take out of this one. So I just put them all. So low blood pressure, the pale, cool arms and legs, chills, difficulty breathing, mental confusion and disorientation, but most importantly, which a lot of people put on here, the sepsis and septic shock. So if you put that, which everyone did, amazing job, amazing, amazing. Now we are going to move to our guideline that we're going to be using. So using all of those keywords, and you can find this guideline in the infectious disease section, and more specifically, the sepsis, severe sepsis, and septic shock mini section. So what specific guideline are we looking for to solve this? I'll give you guys a few seconds with this one. All right, if we are still looking, no big deal, but I see that some people are putting the guideline in the chat. And indeed, this is going to be IC1D2, so sepsis, severe sepsis, and septic shock, infections resistant to antibiotics, septic shock. That was amazing. I feel like that one was kind of hard. In my opinion, I feel like it would be hard for me if I was doing that. So that was great job, great job. So now we are moving on to the final aspect of solving this. We are going to move on to the actual ICD-10-CM codes. So again, severely ill patient presenting with low blood pressure, pale, cool arms and legs, chills, difficulty breathing, decreased urine output, and presenting with mental confusion and disorientation, and the doctor determining that sepsis with septic shock. What specific code or codes describe this encounter? I see you guys already putting it in there. All right, I'll give you guys a few seconds and then we will put everything together. Good luck. All right, everybody hang tight while I switch over to the PowerPoint. I will not give away the answer just yet, but I gotta switch over. All right. Okay, so this is going to be our scenario. And again, these keywords, if we want to look at all of them, we're looking at the low blood pressure, pale, cool arms and legs, difficulty breathing, mental confusion, disorientation. My goodness. And then we are going to be focusing specifically on this sepsis and septic shock. This is how this guideline is going to look. So again, this is going to be under the certain infectious diseases and parasitic diseases. And this is going to be the sepsis, severe sepsis, and septic shock infections resistant to antibiotics and septic shock. So I know that there is a lot right here, But again, if you're looking at the MCG manual and you're kind of confused about how to sequence something, I definitely always recommend looking at the far right column right here, because that is always, helps out with the sequencing of everything. So right here, right off the bat, it says that our principal or our first listed diagnosis first should be the specific underlying systemic infection, or, and it gives us the specific code right here, or A41.9. So that's what we're going to use right off the bat. We know our first code right there is going to be A41.9, and that's going to be the code for sepsis, unspecified organism. So we already got our first code right there. Now we're moving on to our secondary diagnosis. So our secondary diagnosis, it gives us a few options right here. So it kind of, we kind of just have to choose. And again, looking at our keywords, it helps us pick which one that we should do. So since we are being diagnosed with septic shock, then we're going to go down here and it says septic shock. We're going to assign R65.21. So we're going to be using this option right here. We're going to assign R65.21 for general septic shock. And then it says or T81 for post-procedural cases, but we're not using, this isn't a post-procedural case because that was not documented. So this is going to be the code we are looking for our second code, our R65.21, and the specific code is going to be severe sepsis with septic shock. So we are using both of those codes, and that is how we are going to sequence them. And a lot of people got that one right, and that is why we are here. And I know that this is my class, so I'm a little biased, but just these guidelines give such great direction in how things need to be coded. You find the right guideline. If you find the right guideline, it will just, basically direct you to exactly how something needs to be sequenced. And so that's why I think that guidelines are so important, are very important to the coding process, because I would not know how to sequence something like that just, right off bat. I wouldn't know. And so this is definitely, guidelines are just, I just love guidelines. That just makes me a little nerdy, but that's okay. That's why we're here. So I hope that explanation helped for those of you that were putting just like one code, but I think everyone pretty much got that one right or was on the right track. So I hope that someone had an aha moment, as Miss J likes to say. All right, and then that is going to be it for tonight. We ended exactly on time, which is absolutely outstanding. And again, I know that I said this already, but if you have any questions about any of the material that we have went through last week or this week, please make sure to click on that link. I think we'll post it again in the chat before you guys go. If you don't have any questions, still click on it anyways to make sure that you give us some feedback on the class so that we can make it the best tool for everyone to use so you guys can nail those certification exams. Next week, we are going to be in week 3, and we are going to meet right back here Monday at 7 p.m. And I hope to see everyone there. Thank you so much for the team. That is okay. That is why we're here. We're here to learn. Practice makes perfect. I'm not expecting everyone to get every question right all of the time, but as long as we are participating, that is outstanding. So yes, please make sure to click on that survey, and I hope to see everyone back here next Wednesday. Have an amazing rest of your week, and thank you guys so much for joining. Have a great night.
4,000 exam passers and free classes at AMCI. Learn to coach straight from home or on the road at AMCI.